The Philippine Society of Medical Laboratory Scientists Incorporated, or PSMLS, aims to be the best in the field of medical laboratory professionals to provide quality healthcare for Filipinos. Inspired and motivated by the sentiments, concerns, and needs of the laboratory professionals, the PSMLS proactively initiated and sought opportunities to create channels and networks on a national scale that include pilot meetings with key offices and officials and participation in several multi-stakeholder activities. Clinical laboratory are healthcare facilities providing a wide range of laboratory procedures which aid the physician in carrying out the diagnosis, treatment, and management of patients. There are 3 phases in the laboratory, such as the pre-analytical, analytical, and post-analytical, to complete the procedures done within the laboratory. And through quality of service, it ensures accurate and reliable results. The following videos will show the different sections in a laboratory, such as clinical microscopy, hematology, serology, histopathology, microbiology, clinical chemistry, and blood banking. The process starts with the physical checkup of the patient with the doctor to determine the type of examinations to be done. Samples are collected either through outpatient or inpatient. Samples collected are body fluids such as blood, urine, stool, and sputum, and also body tissues for biopsy, autopsy for medico-legal concerns. The pre-analytical phase is the start of the laboratory process. The next stage is the analytical phase. Samples collected are forwarded to the respective sections. Clinical chemistry section is where patients' blood and other body fluids are checked for various chemical components using state-of-the-art equipment. This section determines illnesses such as kidney disease, heart attack, hypertension, diabetes, myocardial infarction, dyslipidemia, gestational diabetes, liver problem, and many more. Hematology section performs routine and special tests on the components of whole blood, such as the red blood cells, white blood cells, and platelets. The section also performs cell counts, differential counts, and other microscopic examinations of cerebrospinal fluid, or CSF, and other body fluids. The test determines bleeding disorder, anemia or dengue, coagulation abnormality, inflammation, malaria, leukemia, infection, and more. Immunology and serology section. Immunology is the study of the body's immune system and its functions and disorders. Serology is the study of blood serum, the clear fluid that separates when blood clots. Immunology and serology sections focus on identifying antibodies. The test determines illnesses such as COVID-19, dengue, hepatitis, HIV, syphilis, and others. Microbiology section is the test to find germs such as bacteria or a fungus to see what kind of medicine, such as an antibiotic, will work best to treat the illness or infection. Histopathology section is the cutting of tissues or specimen and staining to differentiate cancer cells. Histopathology is the diagnosis and study of diseases of the tissues and involves examining tissues or cells under a microscope. Histopathologists are responsible for making tissue diagnosis and helping laboratory specialists manage a patient's care. The test determines the cause of death, malignant or benign cervical cancer, and others. clinical microscopy section performs routine and special tests on patients' urine and fecal sample. These samples are chemically analyzed and examined at the microscopic level. The test determines illnesses such as kidney problem, gastroenteritis, microbleeding GI, sterility, UTI, pregnancy test, diabetes, and many more. The blood bank for cross-matching, blood typing, antibody screening, and more. Using the platelet agitator is one of the most important tools to ensure that the platelets are continuously oxygenated. Blood banking is the process that takes place in the lab to make sure that donated blood or blood products are safe before they are used in blood transfusions and other medical procedures. Blood banking includes typing the blood for transfusion and testing for infectious diseases. The last part is the post-analytical phase, the encoding and printing of the results. Rest assured that the results are confidential within the patient and the medical laboratory scientists. The verifier reviews, signs, and forwards the results to the pathologist. The pathologist then signs the final results before its release. There are other opportunities where medical laboratory scientists can also work. These are clinical laboratory, HIV testing laboratory, drug testing laboratory, newborn screening laboratory, blood service facilities, research laboratories, laboratory for drinking water analysis, stem cell facility, molecular laboratory, and academe. With the help of the medical laboratory scientist, the assurance of quality healthcare in the Philippines is met.
Ang lahat ay nagsimula, hangarin ay magkaisa, kapwa ay tulungan ng walang kapalit. Ang ngiti natin, halina tayo'y magsama-sama sa misyong mahalaga. Bawat isa ay pagpalain sa tunay na hangarin.